In 2010, MSF staff assisted the delivery of more than 150,000 babies.
Once I arrived, they calmed me down and quickly prepared me for surgery. They gave me injections and anesthesia. When I woke up, they said, "Madame, here is your baby." I was surprised, and I said, "Oh, what a sweet little thing."
Whether in Haiti following the earthquake or providing assistance to displaced, refugee or isolated populations, MSF teams often work in settings where emergency obstetric care is lacking.
When the contractions got very strong, I went to the health center. They asked me to find transportation to the hospital. My family went to go find a motorbike. When they found one, I got on the motorbike with the clinic midwife and we left for the hospital.
These two mothers went home with their babies, but each and every day around 1,000 women die in childbirth or from a pregnancy-related complication, a tragedy that can be so easily avoided, particularly with the help of good quality healthcare. Despite the efforts of NGOs, 1 child in 12 suffers from acute malnutrition in the camps that make up Dadaab. Médecins Sans Frontières runs a 300-bed hospital and 4 health centres in Dagale camp. But this just isn't enough, either in terms of quantity or quality.
There is no organized way of receiving the new arrivals now. Registration has been suspended, which means if you come to the camps, you have to find your own way to survive. With your relatives or friends, or if you don't have relatives, then you have to beg. There is no safe haven in Somalia. Even here in the camps, it's not even a safe haven.
When 2 of its staff members were kidnapped from Ifo camp in October 2011, MSF decided to focus on life-saving medical activities. After months of a crisis situation that attracted a lot of media coverage, it's now back to square one. No short or long-term solution has been found, and the refugees' health and living conditions are getting worse by the day. MSF has been providing care to patients with tuberculosis in Armenia since 2005. This team is going to visit a family whose 2-year-old son has been receiving treatment at home for a year now.
His mother is in treatment, his father, uncle, and it became like a family disease for them, you know. And poor child, he's suffering, but we don't have any other choice. I mean, there are no other tablets, there are no other experience. Whatever we can do for the parents, we do for him too.
Galvanize donors, boost research, mobilize public opinion, combat stigmatization. Much remains to be done to improve care for children as well as adults. World TB Day on March 24th is the opportunity to remind us all just how important this is.
This is a typical tsetse fly.
So those are the carriers of the trypanosome parasite that bite people, and it's the blood that carries the parasite and it will get transferred into the blood of the human.
This team travels around the Central African countries most affected by sleeping sickness, or as it is also called, human African trypanosomiasis. The team goes to remote villages to offer screening and treatment to people suffering from the disease.
In this area here you get a collection of people from different villages, and they all come to trade in the town of Ludima, and while they're here in this area they carry the parasites in their blood, and they're tsetse flies typically, along the river, and tsetse will take the parasite and pass it on to the next person. So an area like this is a typical transmission area.
While the disease is fatal if it's not treated, there are drugs that can cure it. The Mobile Teams program also includes awareness raising to help fight the parasite that infected at least 10,000 people in 2009. Protests in front of the Novartis headquarters in New York. Concern is growing in the lead-up to the final act in this long-running legal saga. The last hearing in the case, which opposes Novartis and the Indian state, opens at the Indian Supreme Court at the end of March. If the pharmaceutical giant wins, there is a real risk of weakening the law that enables the production of generic medicines.
MSF absolutely relies on access to affordable medicines for a variety of diseases, as many other treatment providers and donors do. If Novartis wins this case against the Indian government, that will mean that more medical technologies will be granted patents in India. That will mean less affordable medicines for us and for many others. In times where funding for global health is under threat, access to affordable medicines is more important now than ever.
The Indian Supreme Court's verdict is expected sometime in 2012. Until then, NGOs will be campaigning for the rights of the millions of patients who depend on Indian generic medicines.